This is the Ted Wallachin Podcast. Brought to you by Tom's Place. For the finest in men's clothing at unbeatable prices, it's Tom's Place at 190 Baldwin in the heart of Kensington Market. Tom's Place will suit you. And Halenda's, the meat people. Enjoy their award-winning products at selected Metro, Sobeys, Fortino's, and Foodland locations. Halenda's, the way sausage should taste. And now, here's Ted.
My guest today is a practicing chiropractor, acupuncturist, sports therapist, and team leader at ProMedic Sports Injury and Wellness Clinic. In addition, he is the founder of Dr. D's, a line of natural research-based home healthcare products. Welcome, Dr. Fabio di Stefano. Nice to see you again. How you been?
Not bad. Keeping busy, with clinic, and there's been a lot of chronic pain patients coming back after the peak of COVID. So there's been a lot of patients who've been working from home and coming in with a lot of postural issues, as you can imagine. So we've been quite busy with that.
And I was going to ask you, how was your specific practice? I mean, I know that general practitioners, doctors, have been dealing with COVID in their own ways, but you've got a bit of a different chunk of the healthcare market, as it were. How did it affect you?
Really, I mean, we kept practicing. At the height of COVID, at the beginning of COVID, we were able to treat emergency patients only, acute patients, and really anyone who needed urgent care. So, we never really stopped. And if we didn't stop, then, as you can imagine, the emergency rooms would be, filled to capacity. So at least they have us to help alleviate with their nerve, muscle, and joint conditions.
So let's talk a little bit about ProMedic Sports Injury and Wellness Center, and what does that all encompass? What kind of services do you offer other than traditional chiropractic?
Well, it's your ultimate multidisciplinary clinic. It's a wellness center where we combine different disciplines such as chiropractic, acupuncture, kinesiology, sports therapy, massage therapy, homeopathy, as well as nutritional counseling. So it's a well-rounded approach to the patient's condition. Really, it's a one-stop shop, and we also work alongside medical doctors and orthopedic surgeons. So the patient is truly taken care of from all angles, and making sure that we have these different disciplines pitching in on the diagnosis and prognosis.
And the difference between sports massage therapy and traditional massage therapy? Is it that vast?
No, I mean, it's I would say it's pretty similar. I mean, most of our sports massage therapists here, they in addition to your traditional massage therapy, like your Swedish massage, they do a little bit more mobilizations to the joints, similar to what I would do, more trigger point therapy. So they really focus on specific ailments as opposed to just more general. And this is why they work, great alongside what I do, because, they can really help complement the recovery in addition to what I'm doing for the patient.
Now, are you finding now that people are going back to exercising outdoors? That was one of the great saviors during the COVID,
right,
was the fact that people were going outside as opposed to just staying indoors, right, once the weather had changed. But because they are now doing that exercise, are they more prone to injury, or were they more prone when they were just sitting on their backside?
No, I would say they were more prone when they were at home, sedentary. But the other, on the flip side, where you had people doing nothing at home, and then they tried to fast track when they went back to the gym, and you're like your so-called weekend warriors. This is actually, Ted, where most of the injuries came from, because they were trying to make up for what they lost and trying to do it too quickly. Right. Poor technique and rushing at the gym. But so we had, on one side, people that weren't active at home and sitting for prolonged periods, whether it was back or neck issues. And then going back to the gym, they were just, going back or rushing into it with improper technique. So we're dealing mainly with, it was just amazing to see the increased number of low back pain patients and neck pain in all demographics. I mean, we saw quite a bit of young patients as well, with ailments that they should have, later on in life.
I'm wondering if I were to come in to see you with a a sore shoulder. How do you decide whether to treat me in a traditional chiropractic way or whether you decide acupuncture is the answer?
It's a great question. So when you look at, and I treat a lot of extremities, Ted, so it's not all spines. Extremities like the shoulder, which is a very common condition, let's say rotator cuff, for instance. We typically would not apply chiropractic, so there's no adjusting to it. But this would be more of a sports therapy type of condition or treatment where we would combine a few different treatments such as acupuncture, soft tissue therapy, electrical stimulation, laser, ultrasound, so more of a physiotherapy approach. And so this is something actually that we're taught as in our advanced programs in chiropractic school, where you can focus on sports therapy treatments. So something like that would definitely warrant more of a sports therapy type of regimen.
And what exactly, I've heard people refer to an ailment called frozen shoulder, which to me sounds extremely painful. I don't think I've ever had it, but what exactly is frozen shoulder?
Yeah, it's a condition you don't want, Ted. So
yeah, okay, good.
The first day they walk in, I scratch my head and I'm always nervous on explaining the prognosis to them. Frozen shoulder essentially starts off with an injury, let's say tendonitis. And you and I can have the exact same condition, tendonitis conditions, but your body will form, 5 times as much scar tissue. So essentially, it's called the true medical term to the condition is called adhesive capsulitis. Ligaments that surround the shoulder is known as a capsule, and it literally freezes up because of the amount of scar tissue that's formed. So within days, the patient can't move their arm in specific directions, and it is quite painful because the treatment entails breaking up that scar tissue, which is extremely painful.
And how do you do that?
Well, thankfully over the years, we've been able to learn different techniques and how we can combine these techniques to speed up recovery. So acupuncture, anything to do with blood supply. So acupuncture, ultrasound, which involves sound waves to really help break up the scar tissue in the front part of the shoulder, which is really the weakest part of the shoulder. But it involves also a lot of mobilizations, tractioning the shoulder, moving the shoulder around. But you can't do it too aggressively in the beginning. It's got to be done in phases. But with our treatment techniques, we could speed up the recovery by 50, 60%. And in itself, without treatment, frozen shoulder can last up to 2 years. And then the more aggressive approach, if the condition is way too painful for the patient where they can't even sleep at night, or it's really affecting their daily activities, then the other option is a cortisone shot, or some other pain relieving shot that would be given by their medical doctor.
Why do some people still shy away from chiropractors?
I think the stigma right now is when you look at chiropractic is that all we do is adjust or crack the bones, right? Which is not the case. And so if you look at how the old misconception was, again, you go see a chiropractor, doesn't matter what the condition is, they're always going to adjust you. And there are, chiropractors that practice that way, but, we've gone so far, with with chiropractic science, and that now that we're combining a few different types of techniques where people don't need to shy away from chiropractic. And, but I just think it's mostly because of the adjustments. But again, you just have to do your homework. And when patients, call in and to make them feel more comfortable that, they're going to get a thorough assessment. First and foremost, everyone needs an assessment. They need a proper diagnosis, and we need to work alongside their other healthcare practitioners as well.
There are people who go to see chiropractors with the understanding that they're not going to be doing an adjustment on their neck.
Right.
Because there's been stories of things that have gone bad, discs snapping, and et cetera.
Right. Well, you know what? Every condition warrants a different type of treatment. And neck adjustments actually can be quite helpful depending on the patient's presentation, patient's condition, history as well. A thorough history must be done. And, if yes, there's been rare cases of these side effects from neck adjustments. But again, the practitioner or the clinician really has to do a thorough history and to see whether they're a candidate or not. Because we have patients all the time that come in with irritated joints. And one of the best treatments we can do for that patient is a neck adjustment. But again, it doesn't have to be forceful or aggressive. Again, the clinician has to perform a proper examination and then come up with a proper diagnosis and treatment plan.
Are you seeing more patients now than you were, say, 5 years ago? And if you are, and I'm not saying just in terms of your business, but for any specific reason, are there more people coming in now due to dietary concerns, or because they're not exercising, or they're doing it incorrectly?
It's a great question.
Is there any trend?
Absolutely, and this is why I wrote my book. I wrote a book on turmeric because of the increase in inflammatory conditions. And if we look at not just your diseases, your common diseases, whether it's diabetes or rheumatoid arthritis or cancer, which all stem from inflammation, chronic pain conditions also stem from inflammation. And I'm glad you asked that, Ted, because over the last decade, we've seen a drastic increase in the number of chronic pain cases, whether it's low back or neck or any type of muscle and joint or nerve condition. And if I were to go back to most of my patient cases, yes, it has to do with an inflammatory lifestyle. Diets are really horrible. Stress has increased. And as you can imagine with COVID, what it's done to patients or to people in general, stress causes inflammation, causes them to go off their dietary regimens, their proper dietary regimens, lack of exercise, which all result in increased inflammation. And increased inflammation equals, more pain conditions, and that's what we've been dealing with.
My guest is Dr. Fabio di Stefano, who is a practicing chiropractor, acupuncturist, sports therapist, and team leader at ProMedic Sports Injury and Wellness Center. Are you finding, as of late, that more people are coming to see you at a younger age than, say, a decade ago?
Absolutely. And not just myself, working alongside these other disciplines. For example, we work alongside cardiologists and pediatricians. They're actually seeing a lot more of these inflammatory cases at a lot younger age as well. And again, if they were to come up with a cause as to why this is happening, that again goes back to lifestyle. And you look at technology, for instance, all of our younger patients that come in, what do they do while they're sitting in the waiting room? They're all looking at their phones or their iPads. And, they have this terrible posture where, the forward head carriage position, and it's causing, significant neck and back pain.
Yeah. What about carpal tunnel?
Absolutely. So, it goes back to, technology. People are at their laptops more often now. During COVID, we saw a lot more of carpal tunnel, a lot more pinched nerves in the neck, sciatic patients as well, because of what we call the repetitive stress injury. So doing the same thing over and over and over, muscles become fatigued, nerves become irritated, inflammation increases, and you have this vicious cycle that ensues.
You treat, I was reading a certain background, you treat patients who are dealing with menopause. I found that interesting.
Yeah, you know what, we and as an acupuncture provider, there's many points that we can use for different conditions. So we have many of our existing patients, in addition to treating their neuromusculoskeletal conditions, will treat other ailments such as menopause. For example, hot flashes or bloating. Or swelling just in general. So yes, typically with acupuncture, we can treat, various conditions.
Are you finding it frustrating that all of your services, none of your services, I should say, are covered by OHIP?
Yeah, you know what? It's amazing that when I graduated back in 2004, that's when we got delisted, from OHIP, and we thought it was going to be, an uphill battle, but it actually wasn't. I mean, we feel bad for patients that can have the extra coverage. But, I think as a group, we are, we're not that distraught that we're not covered. It's, when it comes to patients, yes, I wish we were covered just to help them out a little bit because it is all private healthcare. But at least they have their private insurance. Most patients, or 90% of our patient base, do have private insurance, so at least they're getting covered by that.
Mm-hmm. Now, we're all aware of the situation in hospitals today, short-staffed. You can wait in an ER for up to 20 hours before you're actually taken care of. I know it's driving people to clinics, but is it driving people to your clinic?
Yes, it is. And thankfully, because there are conditions that we can treat here, Ted, and patients sometimes don't know because they're not educated on the specific condition. So as soon as they begin to suffer with something, right away they think it's something quite harmful, or and they're not seeing they're seeing all the red flags, and so the first thing they do is rush to the emergency. But again, it's going back to COVID. This is what we were seeing. We were seeing patients that would have gone to the emergency, but chose not to because of COVID, and were treated appropriately here at the clinic, and not just with myself but my colleagues. And we can treat a lot of these conditions. I mean, if you look at the number of cases that enter the emerge because of sciatica or even a kinked neck, or sprained ankle, patients really don't know who to seek in those circumstances. But now we're educating them. Is that look out for these signs. These are the red flags when you should seek medical attention. But I think we're getting better at that. And this is what the importance of chiropractic and other alternative healthcare practitioners is that we can reduce the strain off of the emergency wards. And this is why we're here. And that's going back to your question about OHIP. That's where, again, this is where the frustration lies, is that this is a service that should have been covered by OHIP because we are assisting the healthcare system.
It makes so much sense that if you catch something at the beginning, before it starts spiraling out of control, right, it inevitably is going to spiral out of control. If I wake up with a kink in my neck and I let it go, because I've had this happen to me, either because I couldn't get a chiropractor or wherever I happened to be, I just didn't have access to medical care. Then on the next day, that kink on my left side of my neck is now moved over to my right side, and then 3 days later, my entire neck is stiff and sore. I mean, it's just there's such an opportunity to practice proactive medicine
Exactly.
here, and I don't see the community jumping on that or the government jumping on that.
It amazes me because this is all we teach in clinic is prevention. Everything I do in clinic, outside of clinic, is based on preventative lifestyle, preventative medicine. The World Health Organization years ago, more than a decade ago, made that statement that preventative healthcare is the solution. Is more cost effective. Yeah. Is more effective in general. As opposed to to medication and being and treating the condition once you have it. But and patients are understanding now that look, if I catch this in the early phases, it will never get to the extreme aggressive stages. And this is what we teach patients is that look, just because you're feeling fine doesn't mean you shouldn't be coming in. So all my maintenance patients who have a well-rounded lifestyle, they come see me every so often. They have a very good anti-inflammatory dietary regimen. They're active. They're the ones that never really get into this big trouble.
Sometimes these worsening changes are very, very subtle. I'll give you a perfect personal example. Years ago, I had strained my back, and I was dealing with it. It didn't seem like it was that bad until one day I was walking down the street, and I walked by a store, big glass plate in front of the store, and I looked, and I saw my reflection in the window, and I stopped dead in my tracks. I couldn't believe how slouched over I was. I had no idea that I was at about a 15-degree angle as opposed to standing up straight, and I had no idea. I had just gotten used to it over the past days or weeks, and then I look, oh my God, I'm walking like an 85-year-old man. And you don't even really notice because it's so subtle and so slow.
Subtle, and most of the time it's painless. You look at younger patients and say, oh, well, this is, we all do it. And I'm saying, well, that's not a reason why we should be doing it. And so, and it's not a scare tactic, but we tell patients all the time, listen, this is what speeds up degeneration. And that for as long as it's painless, you have the opportunity now because the spine will form that way. And if you look at a lot of these older people, well, in that kyphotic position, the spine actually calcifies in that position, and it makes our job much, much more difficult to try to reverse it. So we're constantly, I mean, postural exercises has been part of our treatment regimen for, for years. And that is, everyone is sent home with a bunch of exercises that focus on reversing that kyphosis or bad posture. And that's a lot of ailments stem from that, Ted. Migraines, headaches, pinched nerves, they all stem from posture. And whether it's sitting posture, standing, or sleep posture, bad pillows, for example, or bad mattresses, these are things that we educate patients on quite in depth.
It also causes people to start losing their balance.
That's right.
Which leads to falls.
That's right.
And the older you are, the more falls you have, the worse off you are.
That's right. Well, it goes back to alignment. What do we do as chiropractors? We try to realign the spine. And the very first thing, because we're specialists in biomechanics, is that a big part of the assessment is looking at posture, stability, symmetry, and we try to correct that. So, we don't use just one tool. Is that we're looking at how do we cure this patient? How do we bring their biomechanics back to normal? This way, there's less recurrences of this condition.
Ted Woloshyn returns in a moment.
Hey, it's Ted Woloshyn for Tom's Place. Our fall merchandise is starting to arrive, but we still have massive amounts of summer clothing that needs to be cleared. Blowout sale prices on virtually everything, like cone suits, regularly $650, now $399 each, or 3 for $1,000. Plus beautiful sports jackets and designer dress pants, 50% off. Check out our deals throughout the store with huge savings off our already below retail prices. If you need a suit for an upcoming special event, we are Toronto's one-stop suit shop. For the finest outfit for every occasion, there is no better time to find the perfect addition to your wardrobe. Everything is on sale to make way for our fall merchandise. Tom's Place is open weekdays from 11 to 6, 10 to 5 Saturday, 12 to 5 Sunday. Visit Tom's Place, 190 Baldwin in Kensington Market. Tom's Place will suit you.
Now back to Ted Woloshyn.
Fabio di Stefano is my guest. You're not only a chiropractor, but you're also a sports therapist. Now, as a sports therapist, I can't go to you and say, I need an X-ray. Mm-hmm. I have to go to my doctor.
Correct.
To get him to sign off on an X-ray. Or a chiropractor can sign off on an X-ray.
Yes. But
why is that?
As a chiropractor, well, because, we're under the Regulated Health Professions Act. And I mean, X-rays is all we can do, but we can't prescribe MRIs or CAT scans or even ultrasounds. So, but at least X-rays are a very good starting point. But again, there's only a few disciplines that can prescribe X-rays. Yeah, it's odd. I mean, we've been battling with this for years. Is that you look at most of our patients where we would know who warrants an MRI, something that's more detailed, and as opposed to talking about a strain on the healthcare system, well, we have to send them back to their medical doctor, when we suggest, and we've been seeing this patient for months, and we're the ones that understand their prognosis and protocol, and so again, going back to the medical doctor. Now, OHIP is paying more money, and just to send them back for an MRI. And so, and I understand that they've cut down the number of patients for MRIs because there's been a lot of, MRIs that have been prescribed that weren't warranted, that weren't necessary. So, but I think, providing us with the ability to send for these other scans, I think would take a lot of strain off the healthcare system.
Let's talk a little bit here about Dr. D's, which is your line of natural research-based home health care products. Mm-hmm. How many products are there? 5, 6 now?
Yeah, well, we have. We started off with a topical ointment called Super 7 active ingredients, and so that's when I started. More than a decade ago, because my research has been since then based on prevention and the inflammatory cycle. So we have Super 7, then we came up with a turmeric product called Ultra Bile Turmeric, and then we came up with a good omega hemp seed oil, and now we have a vitamin D3 plus K2 using our own pomegranate peel technology to increase absorption, in addition to a travel pillow that we developed years ago. But more are coming down the pipeline, Ted, and because of my anti-inflammatory research, everything we focus on it focuses on decreasing inflammation and oxidation in the body, because essentially that's what causes disease, that's what causes pain, and the experts across the globe have now agreed that it's inflammation that's causing a lot of the increase in diseases. And what we focus on in Dr. D's is top quality products to help decrease inflammation and the oxidative stress, but also absorption. That's one barrier we found with other products, is that the absorption was quite low. And we're finding this barrier across the board, and that all of our scientists that are working with us specialize in increasing bioavailability, which is absorption, making sure that you get the most of this nutrient and longer lasting in the bloodstream.
There's been so much discussion and so much concern about immunosuppressed people since COVID reared its ugly face a few years ago. What do you do to strengthen one's immune system?
Again, it goes back to antioxidants, where, our primary defense system is one of our strongest systems. That's what we depend on. And it's unfortunate with these immunosuppressant patients, or these immunocompromised patients, such as whether it's rheumatoid arthritis, whether it's lupus, and so on and so forth, even diabetes. So we focus on, their nutritional regimen, making sure that they really increase their antioxidant levels, with all of their fruits and vegetables, right? For example, pomegranate and blueberry, and all of the bright, dark berries, everything they include in their dietary regimen should include antioxidation and decreasing inflammation. Because if you look at the North American diet in general, it's mainly inflammatory, and that's why heart disease is on the rise. And you look at, for example, taking omegas 3 and 6, whereas you need that ratio between the 3 and 6, which really should be 3 to 1. The North American diet is really 20 to 1, which means they're consuming way too much inflammatory foods as opposed to anti-inflammatory foods. So our focus with not just those patients, the autoimmune patients, but patients in general, with prevention, is to really focus on antioxidants, which are essentially our anti-inflammatories. This way we can really help prevent that inflammatory cycle.
Would you suggest that people, even if they're feeling good, go for an appointment, go for an assessment, because they may not realize that there's something brewing inside them that's going to hurt them or cause serious problems down the road?
Very good question, because as we get this question asked all the time, is that people don't think they're inflamed. It has nothing to do with looking inflamed or being swollen. It has nothing to do with that. They're inflammatory chemicals that exist in all of our bodies. And so what happens over time, you have something called low-grade persistent inflammation that eventually will lead into something, inevitably. And what happens, that's when you see your doctor. Oh, doc, I'm having symptoms. Well, how long has this been brewing? Well, it's been brewing for the last 4 to 5 years, right? Just like tumors or cancer. So regardless of whether you're symptomatic or asymptomatic, it's extremely crucial that you begin an anti-inflammatory preventative lifestyle as soon as possible, because assume that you're inflamed.
I guess it would be similar to somebody waking up one day, going to the dentist because their tooth hurts, and it's suddenly we got to do a root canal.
Right.
That doesn't just sort of pop up overnight.
No.
That root canal has been it's been working on you for a long time. And had you gone for a dental checkup a year ago, they may have been able to nip it in the bud, as it were.
Well, again, going back to the preventative regimen, right, and this whole prevention phenomenon. This is why it's so important. And you look at my clinic, for instance, patients who are proactive never really come in with a severe case, and the same applies to a dental case or any other medical case as well. And the sooner people can implement that into their lifestyle, the better their life will be, and the greater it is for their lifespan as well.
It's been great stuff, and I appreciate you taking the time to talk to us, and let's do it again.
It's always my pleasure, Ted. And thank you for inviting me for these important healthcare topics, because I think it's great education for the public, and looking forward to the next time.
Dr. Fabio di Stefano with the ProMedic Sports Injury and Wellness Center. All the best to you, sir.
Likewise, all the best.
The Ted Wallacham Podcast has been brought to you by Tom's Place. For the finest in men's clothing at unbeatable prices, it's Tom's Place at 190 Baldwin in the heart of Kensington Market. Tom's Place will suit you. And Helenda's, the meat people. Enjoy their award-winning products at selected Metro, Sobeys, Fortino's, and Foodland locations. Helenda's, the way sausage should taste. The Ted Wallacham Podcast is produced by Joey Roselli. Technical production by Paul Gatt. Music by Bike Thieves. I'm Becky Coles. Submit your questions and comments to ted@twmedia.ca.